For many people, varicose veins, large swollen veins commonly found in your legs and feet, are simply a cosmetic concern, but in some cases they can cause discomfort and pain. Dr. John Koziarski is here to tell us about the symptoms of varicose veins and how to treat them. Good morning. Thank you so much for being here.
Hi, Jason.
We're so glad to have you. So for those who don't know, or maybe they've only seen it, what are varicose veins? Explain what they are.
Most people typically identify varicose veins as the big swollen veins you can see in the legs, big ropey purple veins. Sometimes they're little red spider veins. And that's typically what people will see. And sometimes they think it's just a cosmetic problem, but very often they can cause a lot of pain and discomfort and disability.
And something that you brought up with me earlier that I didn't know is that you might have these and not even be able to see them. They don't necessarily go together like that.
Correct. You may have the underlying disease, which is called venous insufficiency, and that's where the underlying veins are leaking in the leg. And then the result of that is the veins that we see on the surface. But it's that underlying leakage and pressure in the deeper veins that we don't see is what's really causing the pain and throbbing. So the result of that is that you can have symptoms in vein disease without really having visible varicose veins.
Okay, so if people are at home watching, wondering, could this be me? What are the kind of symptoms they might be experiencing?
The typical things would be heaviness in the legs, especially at the end of the day, throbbing, aching, burning, itching, sometimes even a skin rash that's unusual. Those are the big things.
Okay. Treatment options. If you're hearing this and people are like, what should I do? Where should they go? How do they start?
Well, the typical thing that's needed first is an ultrasound or a Doppler. Just a quick scan that we do on the leg. It's non-invasive. It doesn't hurt. Takes just a few minutes to get a quick idea of what's going on. And once we do that, we can really see if the veins are leaking or not. To then really come up with a treatment plan, we need to do a very detailed and in-depth exam to really look at all of the veins. But really with a quick little scan, we can get an idea whether or not there's a vein problem or not.
And then how can people get in touch with you or learn more from you if they want any help or they want to explore to see if this is what they're going through? Well,
the easiest thing is that once a month we do a free screening exam where you can come in and get that quick Doppler exam that takes about 10 minutes. Our next one is scheduled for September 25th, and that's at our office, Restorative Healthcare in Battle Creek. And then once a month I also give an informational lecture where we give a lot of information and go into depth in all the treatment plans and different procedures that we can do.
Okay, well, Dr. Koziarski, thank you so much for coming in and walking us through that. Again, you can reach out to him in Restorative Health if you want any more information about this to see if maybe it's something that you're going through. For now, we're going to send it over to meteorologist Randy.